It's a huge quality of life issue. And as you said, we all got here that way. And so, and quite frankly, the majority of adults are having sex. And so I don't know why we don't talk about it, but we don't. Some studies have actually shown that, I don't know, about 40% of patients say it's number 2. Fatigue is the worst when they're receiving treatment and even after treatment, and then especially after treatment, and then sex becomes number 2. Large percentage of these women will be impacted by sexual dysfunction. Sometimes it's mental dissatisfaction, sometimes it's a physical manifestation and they're struggling with sex. If a physician doesn't ask, in general, a patient is not going to bring that up. So physicians really should be asking their patients. It's a quality of life issue. It's an important aspect of life. So you have to ask about sex. How's the sex life? What's going on? What can we do to help you? Is it due to you? Is it due to your partner? You know, tell me what's going on and flesh that out just a little bit more. There are some pills that we can give to women to help with their sexual dysfunction, with their lack of desire. Sometimes there's anxiety associated, especially after some of the surgeries they've required for this type of disease. Sometimes it's just having a frank conversation about sex and saying you're going to need lubricant. You have some vaginal atrophy because the estrogen is no longer present in your body. And so in some situations, we'll go ahead and prescribe vaginal estrogen. In some situations, we'll say, here, you need a moisturizer and a lubricant during sex. Sometimes it's saying, you know, it's more in your mind. A lot of women will be impacted by a loss of femininity, a lack of desire after treatment and during treatment. There are times when it's outside of even my scope, and I'll say, you know what, we really need some help from another physician to help with the pelvic pain, the vaginal pain, the anxiety you're experiencing. But we'll make certain modifications up front, see if we can get the patient more comfortable with sex, and if we need additional help, we get additional help. A lot of women are maybe interested because they know it's important to their partner. And so, and then there are other times when they say, I just want to have that connection with my partner. And I don't want to take it away. I enjoy orgasm. And we have to figure out what we can do, if there's anything we can do, to restore that for them. It's important to talk to your partner, to express your concerns. It's also important to talk to your doctor because maybe there's something physical that can be done, or sometimes we can make some modifications. We can add medications. We can give things to help relax the vagina, or moisturize the vagina, or lubricate. And so it's incredibly important that we have these conversations. And sometimes you're going to have to step out and get some counseling. Maybe there's couples counseling that needs to be done in order to help the patient and their partner really reconnect. A lot of times it's about that conversation. And we have to remember, especially as women age, the estrogen decreases, they go through menopause, the vagina is not as elastic as it once was, their hormones have dried up, their testosterone level tends to drop a little bit as well. They just don't have the same drive in general as they get a little bit older. And so, but it doesn't mean that they're any less interested, it just means that things have changed.
Right.
And so we have to be realistic about that and have these open, honest conversations. And I'm frequently telling my patients, you know what, go be creative, get the lubricants, and even at times go ahead and go to the Lion's Den or some other facility and see if there's anything that you can use to be creative.